Hello, everyone, and welcome to today's session on new benefits. I am Jocelyn Hurd-Gutini, Operations Manager at HSRI for Employers. HSRI for Employers is the exclusive source to offer clients options from multiple insurance companies across all metal levels. Clients are able to customize a plan that works for them and do not have to meet eligibility requirements to enroll. We also offer the defined contribution model, which allows clients to set their healthcare budget, and employees are able to choose the plan that works for them. We have partnered with NFB Health to provide benefits such as life, vision, telehealth, pet insurance, and much more through a variety of carriers. You and your clients can shop, enroll, and pay for benefits quickly and easily while receiving top-notch customer service. I'd like to introduce today's presenters. With us from New Benefits is Reagan Burvis, Vice President of Business Development at New Benefits. A recorded version of this webinar will be available for download and viewing through healthsourceri.com/employers. We'd love to hear from you, so we will be taking questions through the webinar software. There is a chat icon in the middle bottom. Just click it and type in your question. We will answer all questions at the end of the webinar. So without further ado, I'll hand over the reins to Reagan. Reagan, are you on?
Can you hear me?
Yes, I can.
Sorry about that. It must have been a little glitch. Well, good morning, everybody. Thank you for joining. As Jocelyn mentioned, my name is Reagan Burris. Work for an organization called New Benefits. What we're going to go over today, everything about New Benefits, as well as the programs that we offer, partnered with NFB Health and HSRI. And one thing about our organization that you're going to see throughout this presentation is the flexibility that we bring with our product model. So just real quick, high level about New Benefits. We're a 28-year-old company based in Dallas, servicing a little over 25 million members with our products today. And this is a mix of both health and lifestyle benefits, where New Benefits handles, as a single source administration platform, all of the services for anyone coming underneath one of these programs. On the next slide, you'll see some of the services that we actually provide, and I'll highlight just a few of them. From an administration standpoint, we are the source that is handling the enrollment, the billing of these products directly to the either organization or to the member themselves, and these are from a overall perspective, a non-insured benefit program. So from a compliance standpoint, these products are available throughout the U.S. And made available to anybody that is needing services like these, especially in Rhode Island. Specifically for the product that we're going to be talking about today, on the next slide, there are a couple of packages that we've put together. And again, this is what our focus is today. And you can see they're broken into really kind of two components, both on the health spectrum and on the lifestyle spectrum. These services are available for an entire family, so for the individual that is enrolling into the service, their spouse, and their legal dependents. Through the Health Advantage package, we're focused on both advocacy-based services, like a telemedicine with a $0 consult fee, or through Health Advocate with the Health Advocacy service, as well as network-based discounts through vision, dental, and pharmacy services. We then expand that out to what you will see in both the Health Complete package as well as the Total Protection package, to include lifestyle services like ID theft protection, roadside assistance, pet care savings, and global travel assistance. We're going to go over the highlights of the most important benefits out of each one of these packages, but just know, and you can see the pricing on here, when these individuals or employers are looking to purchase this or make it available to their employees or to purchase it as an individual, they are purchasing a package of services. This is not an a la carte offering or a cafeteria plan. So they're either selecting everything in the Health Advantage package or the Health Complete package, kind of a buy-up scenario, or they can, if they want to just focus on the the lifestyle needs, then they can select that Total Protection package. For the Health Advantage package, it's $12.95 per employee or per member per month. The Health Complete package, $19.95 per month. and the total protection package, just those lifestyle products that you see there, are $15.95 per month. So very affordable, very easy to understand. Again, just whenever it is an individual enrolling, it's good for them, their spouse, and their legal dependents. So before we get into the actual benefits in each one of these packages, on the next slide I want to point out a couple things. I want you to keep these in mind as we talk about these products. On the health side specifically, they will complement any traditional insurance plan that is made available to these individuals or that is offered through their employer. Whether that be a high deductible with an HSA, anything with a flex spending account, HRA or PPO, anything like that, these services live outside of the medical plan and therefore can be utilized as many times as needed. The overall focus is to reduce claims experience for both the employee or individual and their family and for the employer alike, because again, because it lives outside of the medical plan, anytime these benefits are utilized, then it's not a claim against that medical plan. Overall, it's all about saving on healthcare expenses and promoting wellness within the workforce or for that individual and their family. There are no limits on the actual benefits use frequency. There's a few exceptions with that when it comes to the telehealth service. Outside of that, those benefits can be utilized as many times as needed by the member or their family. And again, it is a family product. So let's focus on the benefits that have the most impact, starting with the health side. On the next slide, you're actually going to see where we're starting with the Teladoc benefit. Now, this is Teladoc, the largest telehealth company in the U.S. that handles probably over 70% of all consults that happen today across the nation. This is a no visit fee or no consult fee service. So that means every time that one of these members or their family calls in to have a consultation, whether they're able to have a diagnosis performed and a prescription fulfilled off of that call, or if they're redirected to their primary care physician because it's something that cannot be diagnosed or prescribed over the phone, regardless of what happens from that or what the outcome of that call is, there is no cost to the individual or their family member for that consultation. A lot of times you will see the telehealth services embedded into the medical plan, but there is a fee for the consult that happens. Whether they get the prescription or not, whether they get the diagnosis or not, they are paying something out of pocket. We are trying to eliminate that barrier, that threshold, so that they can utilize this service knowing that if they're redirected, they are not losing anything out of pocket. And should they have their services rendered, which happens about 92% of the time where they get a diagnosis and a prescription is fulfilled when they're calling in for the right circumstances, 92% of the time that happens, then they are having basically a consultation with a doctor for no cost. So this is going to be for short-term acute illnesses. It is going to be for things like upper respiratory infections, UTIs, pink eye, sinus infections, symptoms, treating the symptoms of the common cold since you can't cure the common cold, even especially here during the flu season, being able to call in and have a remedy for that specific situation. Right now, we're averaging about a 10-minute response time, but it's guaranteed a callback within 3 hours. This is available, again, for the family of all ages. We do have pediatricians built into this network, and this service is NCQA accredited, meaning the National Committee for Quality Assurance, the same type of accreditation that doctors, groups, and hospitals strive for. Excuse me. As we go into the next benefit, you can see the trend of advocacy continuing. We've partnered with Health Advocate to bring their 3 core services into this bundle as well, first and foremost focusing on their health advocacy service. So if an individual needs to utilize their group insurance or individual insurance plan, this service can help them navigate that world. Whether they have questions on providers to go to, specific procedures that are being done, questions on claims, if they need help understanding their EOB, or untangling any type of medical bill, understanding what they need to pay, finding a specialist, or where they need to go from a pricing transparency standpoint, this is the service that they can call. Once they call in, they're assigned an advocate that will help them walk through that specific case, whatever the situation may be. But the beauty of this service is also that outside of the family, the immediate family unit, Maybe you are in a situation where you're taking care of a loved one, an in-law, or elderly parents. This is a benefit that can be used specifically to assist in that situation as well. We've coupled that also with their medical bill saver component, which is if you have a medical bill, $400 or more in out-of-pocket expense, and insurance has already not paid at a discounted rate if it was in network, for example, if it lives outside of network or an uncovered service like an anesthesiologist bill, this is something where if it's $400 or more, they can go in and help negotiate that rate down. If they're not able to negotiate it down, or maybe it's already processed through insurance, what they can then do is try and go into negotiation on the actual payment frequency. Maybe set you up on a payment plan that if you call in, maybe the doctor's office says they can set you up on a 4 or 6 month plan, they may be able to get a 12-month plan. It's all about reducing those out-of-pocket expenses for those individuals so that they are not wasting unnecessary dollars on health care expenses. And then finally, just like with any major medical plan, we are embedding this service with a nurse line benefit, 24/7 access should you just have general medical questions. Again, these are all non-insured benefits, so they're living outside that medical plan. We're trying to give multiple access points for individuals when they are wanting to utilize the service. And then along those lines, we've also incorporated a benefit called Doctors Online. This service is powered by eDoc America. Again, it's another access point. This is a messaging service, but it's not just related to medical doctors, just those MDs for a consultation, a diagnosis, or a second opinion. This opens up across all specialties. So if you have a stomach issue, for example, my wife has Crohn's disease, I'm able to consult with a gastroenterologist. Maybe I want to just talk about a diet. That way I can get information from both a gastroenterologist as well as a dietitian specifically related to her disease and illness. If I wanted that from her doctor that actually physically sees her, we'd have to schedule an appointment, pay that office visit, and go in and see. Why not message the service and have that professional reply with articles, information, documents, something that I can reference. And utilizing this is no additional out-of-pocket cost for me or my family. There is no prescription writing capabilities through this service, but it is definitely removing the Google aspect or the WebMD aspect of it, so that, if you Google you have a headache or go to WebMD, you're not finding out anything from you drink too much or not enough caffeine all the way to you have a tumor in your brain. So we're trying to bring that more centered to a professional being able to provide that consultation. Switching over in the way that our network benefits operate, I'm going to highlight two specifically that are specifically in that Health Advantage package. Starting with Aetna Dental Access, we're utilizing Aetna's network to provide discounts across the board following their PPO fee schedule. That's going to be anywhere from 15 to 50% savings on general services as well as what you would call specialty services like adult orthodontia, oral surgeries, periodontics, endodontics, all of those different types of things, as well as simple procedures like x-rays in office, the fillings, any type of root canals, replacement crowns or new crowns, all of those different types of things as needed by an individual. This is, as you saw from the price, the $12.95 a month, much more affordable than a family insurance program. Now, we're not trying to say replace that insurance program with a discount program. What we're saying is utilize insurance where it makes sense, and if you hit your benefit max or something is not covered, that's where this discount program can help supplement that family's need. Also, if family dental insurance is somewhat unaffordable or not an option available either through their employer or as an individual, then this is an option to continue or have that family continue to see savings on those out-of-pocket expenses. And you can see some of the average cost versus our discount card specific to this service. We have over 213,000 dentists nationwide. That's across all specialties, whether that's just general dentistry, orthodontia, or anything like that. And finally, the last thing I'll say about that is that this also applies to cosmetic procedures as well. Again, it simply follows Aetna's PPO fee schedule depending on the area that you're in. With coast-to-coast vision on the next benefit, this works very similar to the Aetna Dental Access benefit. Coast-to-coast is actually the benefit we started with 28 years ago. It is the oldest and largest non-insured vision network and service in the U.S. today. We have a little over 20,000 participating providers that include all of the major chains except Walmart, since they have their own program. And it focuses on 20 to 60% savings on frames, lenses, specialty coatings, things like that from those in-network facilities. 10 to 30% savings on eye exams, surgical procedures when performed in that office. But we've also built in a LASIK surgery network, 40 to 50% off the average retail price per eye, as well as a mail-order contact lens organization called America's Eyewear, built in with coast-to-coast vision, 10 to 40% off savings on those soft contact lenses because we're providing that wholesale cost directly to you or to the member and their family. And it can be utilized as many times as possible. Again, like within vision insurance, utilize vision insurance where it provides the best use for the family. If they get that free pair of frames and lenses each year or every 2 years, utilize it for that. But if you want those prescription sunglasses or you want anything else, you can then utilize this service because there is no limitation on the benefit use for the family. So I want to go back over the packages real quick. We talked about the main benefits found in the Health Advantage. You can see there's a couple additional services included, and you can go online and we'll see that here in a minute where you can find additional information about this. But I want to focus in on the buy-up services in the Health Complete package as well as the Total Protection package. Again, $19.95 is the buy-up on the Health Complete, $15.95 on that Total Protection package. On the next slide, you're going to see where we're focusing. That ID Sanctuary ID Theft Service. This is proactive ID monitoring as well as resolution and restoration services. And that's kind of the most important part. Yes, it's great to have your credit reports monitored, making sure nobody's opening up those accounts, but it's also what happens when there's a breach that wasn't a credit card that was open on your account. What happens when your information is found on the dark web? That's where the restoration and resolution services come into play. Along with many, and you can see them all listed out here. I won't mention each one, but many other services. This is very similar to what you would find in the marketplace, kind of as the name brand is the LifeLock service. We utilize a program on the back end that's handling all this monitoring and resolution called CyberScout. They've actually been in business longer than LifeLock and have more members that they monitor than LifeLock does today. So we're only working with the best through our ID Sanctuary service. Where we differentiate from other ID theft programs on the marketplace today is the additional benefits that we build in. So next you're going to see our Global Travel Assistance benefit through On Call International. Now, Global Travel Assistance is like that medical travel assistance where if you travel abroad and something happens, they'll do medical evacuation, payment coordination, work with your insurance. We do all of that and more. We're also helping individuals understand when they're traveling somewhere what vaccinations they need, what they need to understand about that region, currency that is there, document assistance. If something happens while they're abroad, God forbid a tragic accident happens and you have to get mortal remains back, they're going to handle that. But they're also going to coordinate dependent children and family members to travel back. If we were in Paris over the last 2 weeks and the riots were happening, I could utilize this service to expedite me getting back, especially in coordination with a diplomatic office. So they are able to come in and help do all that. And all you have to be doing is traveling more than 100 miles away from home. You don't have to be abroad. I could leave the Dallas area that I'm in and head to South Texas where I'm from, and if something happens along the way and I'm more than 100 miles away from home, this service kicks in for me and my family. One other benefit that I'd like to highlight out of this package, and there's many more that are incorporated in, but the Caregiver Support benefit powered by CareLoop. Now, this service is something that is new in the marketplace, especially on the non-insured side. But what we found very interesting in surveys that we've done, talking to employers and employees alike, is finding that 1 out of every 5 full-time employees are providing care to a loved one in some form or fashion where they could utilize assistance. And they're spending an estimated 15 to 20 hours per week on those caregiving duties. Now, there are services out there that help that loved one that is going through that situation. But what about the individual that's actually doing the caregiving? CareLoop has partnered technology with a healthcare coach that can help these caregivers walk through those struggles, understanding what needs to be done when a diagnosis happens, what's the next step, finding the right facility, God forbid if a family member has to go into one of those assisted living facilities or a mental care facility for things like Alzheimer's, Parkinson's, or anything like that. It helps them understand what medical bills they're going to be expecting, what procedures are going to happen, can help them navigate what insurance that loved one may have and where they can utilize it to the benefit max so that you're not depleting a loved one's savings should they have a situation that happens. And again, that coach is going to be there through the entire process and can even be that impartial third party in a family debate of what to do with that loved one. What they also do on the technology side is enable a caregiver platform where you can invite family members that are responsible or helping with that care support and build kind of that secure document portal where they can load medical records, load information, all HIPAA compliant, and be able to easily share with medical professionals so it's all in one location. This service is gaining a lot of steam in the marketplace. We're seeing a lot of need for it, and it's just more and more as those baby boomers are retiring, as the population ages, more and more of us are taking care of loved ones today. So let's talk about member engagement. What happens when one of those individuals or employees signs up into our program? There's a couple different touch points that are going to happen immediately. Part of what New Benefits provides is the administration for this platform. First and foremost, every single member is going to get a membership kit. That consists of an 8x5 booklet, full color, with information on every single benefit in the package that they selected, specific to their program, with 2 plastic membership cards that they can carry in their wallet. They're also going to gain access to mybenefitswork.com, which is an online mobile-friendly web service that allows them to access the same information just online, as well as our post-sale customer support center that's open Monday through Friday from 7 to 7 Central, 8 to 5 on Saturday Central, where we can answer questions about benefits, post-sale, how to utilize them, where I can find providers for those network benefits, how do I utilize the services on the lifestyle side, all of those different things. Our call center here, these are full-time New Benefits staff members based out of our Dallas office. And then recently, in the last couple of months, we've also launched a program called My Benefits Work. Now, this is our mobile app that is on both the iOS and Android devices, where all of these services, especially like a LifeLock or a Health Advocate, Teledoc, Health Advocate, and our ID Sanctuary program can be utilized all from that one mobile app without having to go out to the vendor's site and downloading their app. We're keeping it all in one location and making it available for those individuals and their families to utilize in a more convenient manner. Again, it's both on the iOS and those Android devices. For those worksite groups, let's talk about employee engagement specifically. It's all about increasing participation. And on this last slide, I want to show you just a couple of things that we can do. We can help generate and provide soft copies of brochures, flyers, break room posters, email content, all of those different things that you can coordinate with employers to push this message out to those employees to remind them they have access to the services so they utilize it. The more they utilize it, the less likely they will ever want to leave these services. With that, I'd like to turn it back over to Jocelyn to see if we have any questions that I can answer.
Thank you so much, Reagan, for joining us today. You've definitely provided us with a lot of useful information. Now let me take a look to see if there are any questions in our chat function. Okay, so I'm not currently seeing any questions in the chat function. However, if we do receive them and it's something that we're not able to answer, we will definitely send the questions over to you. But for all the brokers who are already certified with HSRI for employers and want to know more about new benefits, there are 3 ways to do so. You can contact your business engagement specialist. You can call our 1-800 number, which is the 1-855-683-6757, or you can also visit the website healthsourceri.nfphealth.com. I'm actually going to go there and just give you a brief walkthrough of what you would do when you're on that website so that you can see how easy and fast it is. So this is what the website looks like. Up here you'll see the employer plans, which are the offerings for groups, and here on the employee side is where you will find the offerings that Reagan was just talking about. So we just discussed a few of these, like discounts and services, security packages, and telehealth program. You can just select on any one that you want to know more about, and it will direct you to this page. Here's the option to buy now. If you scroll down, you'll be able to get some more information about the benefits and just an overview of everything that Reagan just kind of discussed. If you are a broker, you can just contact us. Here's the phone number. But once again, if you do want to enroll, it's very easy to do it online. You would just click on Buy Now. And from here, this is the website where you would be directed to, and you click here to get started. It's very easy, very simple. You can just scroll down and you will see the 3 packages that Reagan just discussed, the Health Advantage, the Health Complete, and the Total Protection. And under every single one, you see what the benefits are for each one and the premiums. So it's very easy, very simple. However, if you do have any questions, as I mentioned, we do have a concierge team here to help you. So just contact your business engagement specialist or call the 800 number. However, if you are a broker that is not certified with HSRI for employers, just give me a call. Once again, my name is Jocelyn Hurd-Guitini. My information is on the screen, and I'd be more than happy to help you get certified. Now, just to let you know on what is happening, we have another webinar on December 19th on Washington National Critical Illness, so make sure to mark it on your calendar and make sure to join us. And lastly, we do want your feedback, so if you have a topic of suggestion or something that you want to know more about, just send me an email and we'll make sure to incorporate that in our webinars. And thank you so much for joining us. Everyone have a great day.